When we look at the facial aging, really we have to look at all the areas of the face. Sometimes as we age, the brow comes down, the lateral cheek, but oftentimes the midface or cheek will also descend. One of the ways that we can now address this is with an endoscopic midface lift. And with that procedure, there's two different approaches. We can place the incision either up in the brow when we're doing a brow lift, or if we're doing a lower eyelid blepharoplasty, we can approach it through the lower lid. When we do this through the brow, we use an endoscope and we create a tunnel basically from the lateral brow all the way down to the cheek. And we can free off those cheek structures, bring that cheek up, and put it back where it used to be. And the way we keep that in place now is using the endotime device. And what this is a dissolvable soft tissue anchor that allows us to go underneath this area, and it really helps secure that cheek in the elevated area. When we look at a patient, we have to look at all the areas of the face. And the patient that has a very heavy cheek or a very heavy nasolabial fold, really those are the patients that do best if we bring that cheek tissue back up. This is the midface anchor that we use through the lateral scalp incision. And with that approach, again, the incision is up in the hair-bearing scalp, and using the endoscope, we've already made the pocket, and we can free this up, secure this to the cheek tissues, and elevate the cheek up into place. These anchors, once they're in place, they take about 9 months to a year to dissolve. But by the time they've dissolved, the patient's own tissues basically have healed back, elevated on the bone. So we don't really need the anchors anymore at that point. Here is the typical patient with the midface cheek device placed through the scalp incision. You know, certainly all facial rejuvenation is subject to aging that occurs with time, but the elevation that we see with the cheek is really very long lasting. I mean, it probably stays up in that position for about 8 to 10 years. And as the patient continues to age, it's going to look natural. It's not going to look unnatural or unusual. It's going to be subject to the same facial aging that occurred before the surgery. This procedure is not certainly for all patients, but for the patients that have the really heavy cheeks or the heavy midface, I think it's a nice adjunct and gives a more harmonious rejuvenation.